Last week on my Instagram, I asked you guys what topic you'd want me to cover this week, and the most common topic was actually diabetes. So today's video is going to be on the topic of diabetes. So what is diabetes? Diabetes is when your blood sugars are persistently high. In order to help you understand why this is, we're going to have a cheeky science lesson. So in your body, you have a messenger known as insulin, and it's released by a leaf-like structure called the pancreas. In diabetes, there's an issue with the amount of insulin that's being released by the pancreas. This leads to two types of diabetes that we see. In type 1 diabetes, the pancreas does not make any insulin, whereas in type 2 diabetes, the pancreas doesn't make enough insulin, or if it makes enough insulin, the cells in the body do not respond to it very well. Hi friends, my name is Dr. Uyiosa, and this channel is on all things health, business and finance. My goal is for us to get healthier together whilst making better money and business decisions. Now you're probably wondering, Dr. Uyiosa, what are the symptoms of diabetes? It's important to remember that every individual is different. Some individuals may not experience any symptoms, others may experience symptoms so mild that they actually dismiss it. But typically in diabetes, an individual may feel more thirsty than usual, and as a result they would drink more water, and in having to drink more water they would have to go to the toilet to urinate a lot more frequently. Other symptoms include tiredness, weight loss, changes to vision, etc. So if you know anyone who is suffering from these symptoms, or you yourself are, it's important that you get some medical advice to get yourself checked out. There are three ways in which diabetes is defined. The first way is looking at your blood test results for something known as the HbA1c. Now, without being too nerdy, your HbA1c is basically how much sugar is attached to the hemoglobin, which is part of your red blood cell. And if this is 48 or more, then this is defined as diabetes. The second is if you have a fasting blood sugar level of 7.0 or more. And the last is if you have a random blood sugar test of 11.1 or more, alongside signs and symptoms of diabetes. Now, there are different risk factors for diabetes, but I'm only going to talk to you today about 6. The first risk factor is age. As you get older, your risk of diabetes also increases, and you're more at risk if you are white and over the age of 40, or if you're above the age of 25 and you come from a Black African, Black Caribbean, South Asian or Chinese descent. The second risk factor is family history. If there is someone in your family that has diabetes, then you're 2 to 6 times more likely to get it. And it could be anyone from a parent, a sibling. The third is where you're from. If you are from a Black African or Black Caribbean descent, or you are from a South Asian descent, then you have a 2 to 4 times more chance of getting diabetes in your lifetime. The fourth risk factor is if you have high blood pressure, and if you're wondering what high blood pressure is, I have a video on this which I'll link over here, so definitely check that out and put any questions that you have in the comment section. The fifth is if you have a high waist circumference, and the rationale behind this is if you do have a high waist circumference, chances are you're going to have a lot more fat tissue there, and these fat tissues may not respond well to the insulin that's being released in your body. And the last risk factor I'm going to talk about for type 2 diabetes is if you are overweight or if you're living with obesity. For those of you who are interested in the treatment of diabetes, the treatment depends on which type it is. So in type 1 diabetes, because it's thought that the body is attacking itself, and as a result, not enough insulin is being made, the most effective treatment is replacing the insulin that isn't being made with insulin injections. Whereas in type 2 diabetes, the diabetes can be managed by changes to diet and lifestyle, but if the blood sugars are still not improving, then there are options for medication and insulin injection. There are different things that you can do to help improve your blood sugar levels. The first is exercising. If you aren't exercising already, exercising is a great way to help lose weight, and there are different things that you can do which I've touched on previously in my high blood pressure video, But as a quick recap, you can increase the number of steps that you're doing. You could try brisk walking, you could sign up to your local gym, you could go for a jog. If you have a pet, then you can walk your animal. There are so many fun, interactive ways that you can engage in increasing the level of activity that you do in a way that is sustainable and realistic for you and your current lifestyle. The second thing that you can do is eat a healthier diet. And I know that this is easier said than done. However, you can switch your unhealthy carbs for healthy carb options, which I will list on this side of the screen. You can also cut down on the amount of saturated fats that you're having, the amount of sugar that you're having, and of course cut down on salt, which can help to reduce your blood pressure if that is also high. And the last thing that I will touch on is weight loss. If you are overweight, then I would encourage you to lose weight, and there are different ways that you can do so. Again, increasing your level of activity is one way to do this. Dieting is another way, but if it's something that you have tried in the past and you are struggling with, then I'd advise that you contact your GP, as there may be support mechanisms in place in your local area that can help you with your weight loss journey. And for those of you who aren't sure whether or not you are overweight, there is something known as the body mass index, also known as the BMI. And with this, you put your height and your current weight, and it will give you a value. And this value corresponds to a category. And so if you are overweight, then it will highlight this on there. I will place in the description box a link to a BMI calculator for you to check what your BMI is. And that brings us to the end of this video on diabetes. I hope it was helpful. If it was, don't forget to like, comment, subscribe, and most importantly, share this with someone who needs to know what diabetes is. And I'll see you in my next video. Take care, Dr. Uyiosa.